my name is Margaret Philhower, and I have chronic variable immune deficiency. And I was diagnosed when I was 10 years old, and that was back in 1982. And I was starting to get lots and lots of infections, sinus and ear and pneumonia, and I have an identical twin sister who is totally healthy. She does not have CVID. And so she was growing really quickly, and I stopped growing, so it was kind of obvious there was something going on there. And it took a couple of years to figure out what was going on. So I started getting sick all the time when I was about 8. And when I was 10, they thought the answer would be having my tonsils and adenoids taken out, and that kind of made things worse. And then I got sent to the Mayo Clinic for the experts to try to figure out what was going on. And after being in the hospital there for 10 days, they were considering taking a lobe of my lung out. And luckily, my family doctor was really dedicated to treating our family, and he was doing a bunch of research and came across low immunoglobulin levels being a possibility for me. So we did the test, and sure enough, that's what it was. And back in the early 80s, the way that we did immunoglobulin replacement was through these like big shots with huge needles, and most people got them in their butt, but I was too skinny. The needle got stuck in my bone the first time they tried that, so we switched to my thighs. So 3 days a month, I would have to go to my doctor and get a big shot in each one of my legs, and it hurt really bad, but I stopped getting sick all the time for the most part, and that was helpful. So luckily we moved out of the Midwest to Boston in the mid-80s, and they were doing some research at Boston Children's Hospital on IVIG, the IV form of the immunoglobulins, and so I got into that study, and that was a lot easier, just once a month, the IV, and I got a little bit healthier, which is good. And so that was the form of treatment that I did for many years after that. I did switch to subcutaneous in about, I think it was like 2005, 2006, somewhere in there. And I think it's great. My veins aren't that good, and so I was starting to have to try a few different spots to get it in, and it was really frustrating. So I love the subcutaneous route. It's pretty easy. I'm doing it once a week now. I can do it myself, and so it feels really empowering to do it that way. And so, that part's pretty good. The replacement of immunoglobulins isn't the be-all, end-all. I'm not 100% healthy just doing that. So, I still get some lung and sinus issues, and so over the years I've really done a lot of research to try to get healthier and healthier and be as healthy as I can be. And so kind of the silver lining of all this is that it motivated me to become a naturopathic doctor. And so I focus in my career as helping people use natural, simple methods to treat all kinds of different things. And I started using things like wovenzyme, which is a bromelain from the pineapple plant. It's a proteolytic enzyme that helps the immune system kind of work a little better. It's anti-inflammatory. It digests mucus. It helps with allergies, and that's really helped me a lot. So that's one natural pearl that I would encourage people to explore. I do occasionally still need antibiotics, maybe twice a year on average. And I like to use the best of both worlds. I think Western medicine is great for emergencies and these obscure immune deficiencies. I definitely think immunoglobulin replacement is really important, but that may not be enough to make you 100% perfectly healthy. I think some people are healthier than others with CVID. It's really variable, like the V in that acronym. So herbal medicine helps me a lot. When I'm starting to get a cold or something, I'll use different herbs. OSHA is both antibacterial and antiviral, so that's a good one. And there's vitamins, simple things, vitamin C, they help a lot. So that's been something that over the years I've learned more and more about, and different tricks to kind of help me stay healthy. So I encourage you to try different things and experiment and not give up, and use the tools that are available. Sometimes people get like really frustrated by this diagnosis and just want to be 100% natural, and that may or may not be possible. So but I think the best of both worlds is the way to go. That's what works for me anyways. So I also just want to encourage people to stay positive. When I was a teenager, I was really frustrated by being different and having to do this like annoying treatment, and I thought it really sucked, and I was totally bummed about it. And when I went to college, I think I like ditched out on it for like 6 months, and then got a really bad pneumonia. I was like, oh, guess can't do that. So I've just found that there's sort of a balance that really seems to be the way to go. And so now I'm just really all about thinking positive and trying to use like these adversities, these like negative things that happen in life as like a lesson. It's like, I look at my illness as a teacher, or like a lesson in life. Like, what can I learn from this? How can I take this situation and make it mean something, or make my life better because of this? Rather, like accepting it, rather than just like being pissed off about it and just wanting to ignore it. That doesn't really work. So I just want to encourage people with a new diagnosis to not give up, and just try to like make this as a catalyst for positive change in your life. And I think that's really possible, and that attitude has really helped me a lot through this, because it's not the greatest thing in the world, especially when you're dealing with insurance companies and that sort of thing. But on that note, I found that where there's a will, there's a way, and you just need to talk to the right person. Just keep asking for help, and the Immune Deficiency Foundation is great that way. Most immunologists are really helpful, and I found some really helpful patient assistance programs. The Affordable Care Act is helping me personally be able to afford this medicine as well. So it's frustrating sometimes, and none of us want this to happen to us. None of us ask for this or wish for this, but it is what it is. So I just want to encourage y'all to like stay positive and just use this as a catalyst for growth and positive change, and try to look for the silver lining. So thanks for listening.